And let's talk a little bit about those screenings, because I feel like that's sometimes the reason people choose not to go to the doctor or not to go to their annual visits, is because they're afraid of imaging and ultrasounds and things like that. So what kind of screenings are available, and what, who should have them, when should you have them, that kind of stuff?
I like shared decision making. I like discussing their personal history, their family history, their risk factors, so that they can have the information to make the decision that's best for them. But our standard recommendation is a yearly mammogram in the average risk population. So if somebody doesn't have average risk, they have an elevated risk or maybe a personal history, they might fall into a different category where they're getting it every 3 months or every 6 months, or alternating with MRI or whatever that may be. But just as a routine baseline average risk population, we do recommend yearly mammograms, typically starting at 40, again, if they're not having any other risks or complications.
Yeah, I agree. There's a lot of different guidelines, but most institutions recommend starting at the age of 40 annually. Mammogram is the typical way for screening. There are other modalities. We talked about the MRI, ultrasound. As of now, screening mammograms tend to be the most kind of widely accessible. MRIs, there's limited access depending on where you live. You might not have the same access. And ultrasound has pros and cons to it, where we still kind of recommend mammogram as kind of the gold standard for screening.
The gold standard, that was exactly the word that was coming to my head, because that's what you hear about the most. Is there anything else that you kind of want to share or make sure that people understand when it comes to breast cancer awareness?
I think just making sure that you are connecting with your healthcare provider on a consistent basis. I think with COVID and busy lives and women having complex responsibilities, I think it's easy for them to not put themselves first and to let those kind of go over time. And it's just important to have that tight connection yearly at least with your healthcare provider to make sure that you're getting everything done, whether it be from a general health perspective or breast perspective.
Yeah, from my standpoint, I think one of the big misconceptions with breast cancer is, every cancer is different. And so a lot of people just kind of put every cancer in a similar type of bucket. For breast cancer, it's the most common cancer for females outside of skin cancer. And I think around 80 to 85% of patients who develop breast cancer have no family history. So that's kind of a big point to know. A lot of patients think that because there's no family history, I have no risk of developing breast cancer, but that's a misconception.
That's,
Absolutely. And if they have a family history or they have a genetic marker that puts them at higher risk, their risk goes up significantly. But like Dr. Kim said, there's 85 to 95% of people that have zero family history. We don't know why they got it. There are a lot of different factors or reasons why someone can develop breast cancer. And if it's caught early, they have the best chance.
Right, there's a lot of treatment.
And so a lot of times I will do their exam, they will do their exam, and we felt nothing. And we find just a tiny spot on mammogram, and then we're able to intervene so much sooner. The outcomes are just so much better.
And sort of a follow-up question to that, I know Dr. Google is a very dangerous thing, but I recently had read a study that alcohol use is like a new factor that they didn't, are there like environmental factors and things that people can be doing to kind of prevent on their own end, or is it just sort of like you were saying, even if there's no family history or you're not doing things that are risky, you can just still get it?
Yeah, I think there's a lot of environmental factors. We just don't know if we can pinpoint one thing. People say there's a decrease in exercise, overall kind of BMI increases contribute to a lower age of, breast cancer development. But, I think screening is kind of the best tool we have. Trying to do your best to stay healthy, being active is also, great things. But it's always hard to, recommend that as that's how you prevent breast cancer.
Sure.
Which is good for overall health in general as well. So.
Yeah.
Just healthy habits. Well, thank you both so much for chatting with me, and thank you for spreading all of this great information and for sponsoring our segment today.
Of course.
You're welcome.
If you want more information, you can visit us on the web at ciLiving.tv.